Hello, viewers, and good afternoon. Welcome to Science TV 1 p.m. news with me, Elvis Othiambo, and my sign language interpreter doing the voicing, Irene Chebiwot. Let's focus on our news. Kenya received its first shipment of HIV prevention medication on Monday night, marking a milestone in the country's efforts to curb new infections. The drugs target individuals at high risk of contracting the virus and are neither a vaccine nor a cure for HIV. Dr. Patrick Amoth, Director General of the Ministry of Health, received the shipment at Jomo Kenyatta International Airport and confirmed that distribution to the public will begin in March. The rollout will focus on counties with the highest number of new infections. The initial rollout will focus on 15 counties with the highest rates of new HIV infections. Residents in areas such as Mombasa, Kilifi, Machakos, Kakamega County, Siaya County, Homa Bay County, Kisii County, and Kiambu County will be among the first to access the medication, which will provide protection for people who are HIV negative but at high risk. Health officials say the initiative is part of a broader effort to reduce new infections and support vulnerable communities across the country.
Initially introduced in Eswatini and Zambia, but we are the first in East African region. And this product has been in use in other jurisdictions where it used to cost about $48,000, as I told you earlier. So we have also gathered sufficient evidence about its efficacy, safety. Anybody who is HIV negative and is at risk, then is eligible for this product. We are not going to say that we are going to prioritize a particular group of people because that will run the risk of isolating the product for a particular group of people and therefore deny access to other people who would actually qualify for the product but out of fear turn back.
Lenacapavir is going to be a very instrumental piece in providing HIV prevention in country, as it's a shot, an injection that someone's able to take 2 times a year and will give a full protection, just as what the pills that were taken once per day previously were done.
Moving on, a family in Soweto area of Kongowea, Mombasa, is appealing for help to trace their 5-month-old baby who has been missing since February 7th. The infant's disappearance has left relatives distressed as efforts to locate the child enter the second week. According to the family, a friend who had been temporarily accommodated in their home allegedly left with the baby and has not been seen for nearly 2 weeks. The circumstances surrounding the incident remain unclear. The family has reported the matter to authorities and is urging anyone with information that could assist in tracing the child to come forward as investigations continue.
Mchana nikaenda kwa mzee kuchukua pesa lunch na mwachia mtoto, narudi hakuna mtoto. Sasa hiyo Jumamosi nikamwambia naenda ushirika. Kwa saa 8. Akasema mimi sitoki. Mimi nikaenda ushirika, nikakuja saa 11 hapo. Kukuja ametoroka na mtoto.
Mimi nilisubiri. Sasa nilifika saa 3. Nikamwambia bwana, sasa hii mimi siwezi vumilia, ngoja nikamtafute. Nilienda kuzunguka kule kwenye maduka, nilienda mpaka Kongowea msikiti mkubwa, sikumpata. Ikabidi nirudi tena kuja kumuuliza tena, ili kwaje ukachia rafiki yako mtoto, kwani wewe ulikuwa wapi? Ananiambia yeye alikwenda ushirika akamwachia mtoto.
Nikamwambia waenda na mtoto wa watu, akasema yeye anaenda naye. Sasa venye aliniambia mimi nikamwambia na mamake anajua. Akasema hakuna shida, mimi nitaenda naye. Nikamuuliza waenda saa hii, akaniambia anaenda ndani mwanzo. Venye aliniambia enda ndani, mimi nikamwacha nikaingia kwetu, yakarudi huku.
Nimelose hope ya maisha kwa sababu hakuna amani kwa ndoa yangu sasa. Baba mtoto ananiambia ama tumeshirikana na huyo msichana kuuza mtoto. Tumeenda paka kwao. Babaka ananiambia wewe ukimpata tufanye chochote. Unaona? Nimezunguka kila mahali. Nimekosa msaada. Naomba mama wenzangu, baba wenzangu, wazazi wenzangu wanisaidie kama mama wenzao.
On to our other news, a fire broke out on Tuesday evening and destroyed a dormitory at a children's rescue center in Thika, causing extensive damage to property and infrastructure. The cause of the blaze had not been established by the time authorities visited the scene. The fire erupted while the children were in school, engulfing nearly all belongings inside the dormitory. Officials confirmed that none of the 44 children housed at the institution was injured or killed in the incident. Karen Angengo, a senior official in the Department of Children's Services, toured the facility to assess the destruction and pledged immediate assistance to support the affected children as recovery efforts begin.
Appeal to all county governments that we need to have fire extinguishers and response rate that can be very quick to be able to save situations and not just having a whole building going down, like what has happened to
this evening, and to make sure that these children, they are our children. These are children that they have been rescued from different homes or from different categories in life. They are running from something. They are not running away from the government, but they are running away from homes because something happened. Some felt insecure. Others felt that they were going to be hurt in their homes. That's why they were rescued by this institution.
Aberdare Teachers Training College in Daragwa constituency, Nyandarua, will gain a new 5-story student hostel designed to accommodate 680 learners. The project aims to enhance student housing and improve learning conditions at the public training institution. The 346 million shillings development will be implemented through the Government Department of Housing and Urban Development in partnership with the Daragwa Constituency Development Fund. It forms part of the government's affordable housing program and seeks to provide quality accommodation for students. Once completed, the new hostel is expected to pave the way for similar projects, addressing the growing demand for students, lodging, and ensuring better living facilities as enrollment at the college continues to rise.
Teachers, you'll be learning in conducive environment for you to concentrate on your studies, knowing that eventually it's you people we are leaving our children to. I think, God willing, in the next 10 to 15 months, we'll have some infrastructure in the name of hostels that will truly reflect that you are in a national institution.
Today, we want to thank God so much because our MP is with us and all the things that we needed, including for the community, where we need a road that needs to be tarmacked, our problems have come to an end.
Ndio hii project imekuja kwetu. So kila mara tufikirie maendeleo. Kila mara tushikane na kiongozi wetu ambaye analeta maendeleo katika area yetu.
That's all we had prepared for you, our viewers. Thank you for joining us For the 1 p.m. news, you've been with me, Elvis Othiambo, and my sign language interpreter doing the voicing, Irene Chebiwot. Enjoy your lunch and goodbye.